Clinically, there are two major ascending pathways in the somatosensory system that we examine as far as the sensory neurological examination. The first system is the spinothalamic system, which we test by looking at pain and temperature. The spinothalamic system is a part of the anterolateral system. The second major system is that of the dorsal column-medial lemniscus system. We test this particular system by looking at position sense as well as discriminatory sensation. Of course, this particular system gets its name because of its location in the spinal cord in the dorsal columns. For the anatomical review, we'll look at these two systems, their anatomical location, and how important anatomical points correlate with the neurological sensory examination. The anatomical pathways for the two major sensory systems are as follows. The spinothalamic system. The axons from the first order neurons located in the dorsal root ganglion enter the dorsal root entry zone and within several segments synapse with the second order neurons in the dorsal horn. Axons from the second order neuron cross immediately via the ventral white commissure to the anterior lateral quadrant of the spinal cord and then ascend as the spinothalamic tract to the ventral posterior lateral nucleus, or the VPL, of the thalamus. The axons of the third order neurons project to the posterior central gyrus or somatosensory cortex, the dorsal column-medial lemniscus system. The axons from the first order neurons located in the dorsal root ganglion into the dorsal root entry zone and then ascend in the dorsal columns on the same side of the cord until they reach the second order neurons in the medulla. Axons from the second order neurons cross at the level of the medulla and then travel near the midline in the medial lemniscus. By the time the medial lemniscus reaches the rostral pons, it has moved laterally, and at this point it is in close proximity to the spinothalamic tract as it ascends to the VPL of the thalamus. The third order neuron projects to the primary somatosensory cortex in the posterior central gyrus. The trigeminal system is the somatosensory system for the face, which is clinically tested in the cranial nerve exam. For the trigeminal system, it is important to remember that the descending tract of the trigeminal nerve, which serves pain and temperature, descends to the level of the upper cervical spinal cord, and then axons from the second order neuron cross over to the opposite side and ascend to the ventral posterior medial, or the VPM nucleus of the thalamus. The following are important anatomical points to remember that have significant power in localizing lesions. Number one, the level of crossing of the axons of the second order neurons is immediate for the spinothalamic system and not until the medulla for the dorsal column medial lemniscus system. Number two, the spinothalamic tract is lateral in the cord and lower brainstem, while the dorsal column medial lemniscus system is dorsal and medial in the cord and medial in the lower brainstem. It is not until the rostral pons that the two tracts are anatomically close to each other. Number three, the descending trigeminal tract is ipsilateral to its origin, and axons from the second order neurons cross at the lower medulla upper cervical spinal cord level. The above anatomical points translate into the following clinical findings. Number one, spinal cord and lower brainstem lesions can result in sensory dissociation, which means one sensory system is affected without the other. Number two, crossed or alternating findings. For example, one side of the face is affected while the opposite side of the body is affected for brainstem lesions. In the spinal cord, lesions can cause dorsal column system findings on one side of the body and spinothalamic findings on the opposite side. The spinothalamic system is examined by testing pain and temperature. The dorsal column-medial lemniscus system is examined by testing vibratory sensation, position sense, and discriminative sensation. Now, discriminative sensation must have not only an intact dorsal column medial lemniscus, but also intact parietal cortex. The tests that we use for discriminative sensation include tactile direction, two-point discrimination, graphesthesia, stereognosis, and double simultaneous stimulation. Traps. Light touch is represented in both the spinothalamic and the dorsal column system, so it's okay for a sensory screening test, but it's not specific for either system. The sensory exam is perhaps the most subjective of the entire neural exam, so patient response can be difficult to interpret and at times be misleading. Pearls. A sensory level is valuable in determining if there is a spinal cord problem. Sharp sensation is used to determine the sensory level. The sensory level on examination is usually 1 to 2 spinal cord segments below the actual spinal cord lesion. A sensory deficit from a spinal nerve lesion will be in a dermatome distribution. A sensory deficit from a peripheral nerve lesion will be in the distribution of that peripheral nerve. A sensory deficit from a polyneuropathy will have a stocking and glove distribution because the longest axons are the most affected and are the first to be affected.